I'm going to tell a story. That's how I'm going to start this competency conversation out. When the branch was first formed, I set up 5 committees. We had, of course, in the branch, we had all of our training, preparedness training folks out throughout the state. And so we set up a preparedness committee. I set up an environmental committee. Everything go here. Everything's going wonky. I have joked about this one for a while, but I set up a nursing committee. And I joke about it because I call that committee, I believe, the Nurse Administrative Group. And the commissioner dropped by one of our first meetings, and Rosie was sitting in that meeting, and he said, "Oh, Rosie's negs are meeting today." And there was a vote that maybe we would change that to the Nurse Executive Committee.
A bunch of nags.
A bunch of nags. Oh, that was so, if I had a camera for the picture on her face. I established a leadership committee. And lastly, I established an informatics committee. Purpose of these, the thought was these committees would be short-term. I wasn't, back in the early 2000s, I wasn't a big fan of committees. There was just a lot of chin wagging that resulted in nothing, no results. And I was more interested in getting things done. The purpose of these committees, one of the purposes of these committees was to bring various levels of leadership and workers together in preparedness and in environmental nursing and leadership and informatics. And the idea was to identify training courses that every preparedness person should take, every environmentalist should take, every nursing physician should take, those interested in leadership or those in leadership should take in informatics. Out of all of these, the most one near and dear to my heart was informatics. At this point in my career, I have visited every health department in the Commonwealth at least 2 times, and many more, many times. I'd walk through a health department and I would see desk after desk with a calculator and a desk light on it. Didn't come across too many green-eyed monster computers. They were there for billing. And we were entering a time at the state level and at the local health department level where we were just beginning to turn paper processes into computer processes. And I could just see all the trouble that was ahead of us. Garbage in, garbage out. Ethical issues rose to the top of my mind. 3 years later, a UK faculty member took on a grant to study Kentucky Train. As part of the results of that study, it was pointed out very clearly that our train courses, the title, the learning objectives, and the course description were out of line for a majority of our courses. Meaning, you could read all 3 of those, and they were all just addressing 3 different, they seemed to be addressing 3 different things. The description made no sense as far as the learning objectives. They took a deeper dive into train and looked at other data fields and just saw error after error after error. I can't sing enough praise for Lisa, that has done so much for Trane in so short of time, and bringing her quality assurance ideas to the table and implementing the program we have today that I think stands head and shoulders above any training program across the United States. And that just, it took a lot of years to get there. It took a lot of years to get there because the turnover in that branch has been so great. And you know the training process is slow. And I have trained and retrained and retrained and trained, trying to get people up to a certain speed. And then they move on because of money mostly. Well, it's no different in 2022. Stack wants a leadership program put together to identify leadership courses. That's no different than 2005. A couple of weeks ago, Ruth speaks up on a Monday meeting looking for courses, core courses for nursing. Preparedness, we had somewhat of a handle on it. It was all those FEMA courses. That was all kind of outlined by their grant again. Environmental, you don't hear too much about them, but they do raise their heads every once in a while. You know, they want a certification program for their environmentalist. Becky does. That's a 10-year conversation that's been going on. Identify those courses that every environmentalist needs to take. And informatics, I think, is only in my head. I don't hear too much about informatics these days, but there's a lot there. And in my module of Public Health Past, Present, Future, there's a really good section on 4 or 5 video clips talking about informatics. It's really good. So here I am with these committees. We're meeting month after month. We're getting no closer. And of course, Trane back in the early years, that catalog was thin. There's probably only 3,000 courses in that Trane catalog. And we're just meeting, and all these nurses are going, taking all of these courses and trying to find something that, and the same for leadership. Now, leadership spilled out into K-Philly, and we had K-Philly as a grant in our branch, and that met a lot of leadership boxes. There wasn't all the Public Health 101 courses back then. They just didn't exist. It was too early. Everything was face-to-face, really, those early years. So I was invited to Atlanta. These meetings have been taking place 4, 5, 6 months now, getting nowhere, wasting people's time in my thoughts. And the meeting, I think, was sponsored by Emory. And I'll just never forget the day. It was one of the first sessions. It was put on by a nurse that's very similar to Ruth. I would imagine this nurse had her walls full of plaques. She had alphabet soup behind her name. But one thing that was different about Christine Gabby is she was a writer, and she wrote books. I don't know if Ruth's written any books. She hasn't. She should. And she was going to talk about competency education. And I sat through that session, and she talked about finding the skills people needed to do their jobs. What are those core skills that they need to have to do their jobs? Well, by the end of that session, I was just jumping out of my seat, and I was just ready to walk back to Frankfurt and get back to work on these committees. I was just so pumped up and excited because I realized in that session that we've been asking the wrong question this entire time. We don't need to know what 10 courses every nurse needs to take. We need to know what 5 skills that nurse needs to have. What are the 5 basic skills? And those skills are already laid out and trained. That's all there for us. And my thinking was, and I did, when I got back to these committees, nursing committee, what 5 skills, the basic skills all your nurses need? Let's just start there. What do they need to be able to do? And let's look at this Council on Linkage competency set. Do they need to communicate? Is that important? I think so. Do they need to take care of the data? Does it need to be accurate? Gosh, I think so. And we just went on and we went on. But then I ran into another stumbling block that didn't get resolved, I feel, until this year. As those competencies and training were written by a bunch of academics. And they weren't academics at the time in 1998 and going forward that were really excited about writing these. Because those academics in their colleges and schools of public health, they had their competencies and they were scholarly in the way they were written. They had meaning. These things that we're writing now, they don't go deep. They don't get at the skill. These are fluff. And there was probably a 5-year battle between we want our colleges and schools of public health competencies out there. We don't want this Council of Linkages competencies. They just don't meet our scholarly standards. But they moved on. There was very little practitioners involved in this 100-group Council on Linkages committee. If they had any public health experiences, they probably retired from a public health director position and were now teaching at one of the local schools. I think I was the only one from I know I was the only one from the trained community that was on this council. And I didn't have an alphabet soup of initials behind my name. I just had a mouth and I used it. I was probably Brad on this council, in fairness. But I could see from the very beginning when I met with my committees and I started having them read through these skills and choosing what basic skills each of their community representatives needed, they couldn't understand what they were reading. And I couldn't explain it to them. And so I started a platform to this council to simplify the wording of something they didn't already believe in, and then to ask them to simplify it further just went against what they wanted to do. They wanted to make it more complex, measure up to what competencies they were using in the schools. And here this kid from Kentucky with barely a degree was telling them to simplify the language of their skills so that people could understand them and use them. This council met every 3 years to make changes. Every 3 years, I got on the same soapbox and I was loud. Maybe too loud. I was Brad loud. But I was trying to shake the tree and get their attention. The last few years, the last 3 changes, I'd start getting these emails from council members. David, I totally agree with you. I totally support what you're saying. But they wouldn't stand up in these committees, and they wouldn't stand up for me. They would just do these little secret messages. I worked hard with Janet Place over at North Carolina School of Public Health. I really had support with Janet. And she finally became vocal. She finally stepped up in these committees and said, I believe what David is saying is right. They came up with this last changes to the competencies this last go around. And oh my gosh, they made it such a complicated. If you could just see the draft things they were doing, it was making a convoluted mess out of these things. And I just got up in front of those 100+ people and I said, you can't do this. You're making a mess of these things. You're making a mockery of these things. People aren't using these because they don't understand them now, and you're just adding to the spaghetti here. They're not even going to be able to follow the roadmap you've laid out for them. You've got to simplify these things. You've got to reduce the number of them because a lot of them we called over the years double barrel, meaning one competency had 2 competencies written in it. They listened. Ron and Kathleen listened. Key people on the council listened. And they did, in fact, simplify this go around the skills. I think they're much more readable and I think application is going to be so much easier for us. They still have the 3 tiers. The 3 tiers still follow a career path. Tier 1, you do. Those are for the folks that are kind of new to public health. Not in positions, they're working the trenches. Tier 2 is mid-level management, supervisor positions. And Tier 3 is for later in your career, when you're in leadership positions. And we've got 2 people right here that are just represent those careers. You can follow the path of Sharon, and you can start following the path of Tom. But just kind of follow that career path. That Tier 3 position, those are policy folks for the most part. I'm generalizing. They're creating policy. Middle management folks, they're implementing that policy the best they can. And the Tier 1 folks, they're following the policies. That's a generalization, but that's kind of how these things flow back and forth. These tiers are divided up into what's called domains. The domain language has changed over the years. Domain 1 is dealing with data. Domain 2 is dealing with policy development. 3 is communication. 4 is something we used to call words, David. Cultural competency. They're now calling it health equity. Community partnerships, very important in public health transformation. Public health science skills, we can talk for hours on that. The same with management, finance skills, we could talk for hours on that. And leadership and systems thinking skills. Kay Philly used to really focus on the systems thinking skills and did a good job with that. that's the outline I wanted to talk about today. And here we're at the top of the hour. And I didn't save any time for questions. I'm sorry. I hope you got something out of that.